2021 special symposium on tobacco control in the ASEAN University Network, Health Promotion Network. We are pleased to have several member universities of ASEAN University Network participate in this APACT 2021, as the tobacco control is the main topic of AUN-HPN or ASEAN University Network, Health Promotion Network. So today we are pleased to have some member universities are willing to show their work on tobacco control. So with a presentation from University of Gajah Mada, from the former executive director of Asian University Network, Health Promotion Network, Professor Viwatrojana Pitayakon. And after that, we will have a presentation from University of Gajah Mada, National University of Singapore, University of Malaya, and we will have the final presentation from Mahidol University, and we will close the session by noon. Thank you.
Thank you very much, Dr. Wick. Good morning, everyone. I'm very pleased to join this very special APACT 2021 conference on tobacco control. I hope you can hear me well. My topic is just to introduce the AUN-HPN and just to lead to the presentation of the other 4 speakers. And I would like to start by saying that in order to promote health of people in any university settings, I think there are so many roles of university to do so. Number 1 is to teach health promotion. And number 2 is to provide health promotion services to student, personnel, and communities. And then number 3 is to implement a healthy workplace on particularly on the using the healthy university framework initiative. There are some items that being included in the list of the topic or issue to be tackled or to be addressed for promoting a healthy university. Number 4 is to build capacity of the workforce. Workforce not only means students, but also after their graduation, there will be active health promoters in the society. Number 5 is to conduct health promotion research. And the last one is to advocate and support development of public policies, healthy public policy at all levels. For the AUN, there are 30 universities among 10 ASEAN countries or within 10 ASEAN countries. And you can see that it's a list of names of universities and scattering throughout the region from Brunei, Cambodia, Indonesia, Laos, Malaysia. And you can see the number of universities participating or included in the AUN vary from 1 to 5, and all of them are very active members of the AUN system or network. AUN mean ASEAN University Network, and within the network they have some sort of sub-network to promote collaboration in different areas. Not only collaboration, but development. And one of the sub-network is health promotion sub-network. And we use acronym as AUN-HPN. It's a thematic network among ASEAN universities that dedicate to promoting health in the region. And one product of the, maybe some, I'm not quite sure you see the screen clearly, but anyway, I will continue. One product of AUN-HPN is the development and dissemination of one document called Healthy University Framework. The idea behind this document is that if we are going to say that University A, University B each university is a healthy university. What are the criteria? What are the components that should be analyzed or should be looked at in order to rank or to advocate that they are really the healthy universities, and on within this document, this is the cover of the document called ASEAN AUN Healthy University Framework, which is easily downloadable from Google. You just type the term Healthy University Framework. It will be the item number 1 in the Google outcomes. And on page 12 of this document, it show or demonstrate 22 areas that need to be tackled or need to be addressed in order to improve health in a university setting. And on the left side, it's a system and infrastructure. There are 9 items, including the healthy university policies, which have to be issued by the president or by the rector of the university. And then there are many other areas that the university can manage, can arrange. For example, training, teaching, providing budgetary support. For example, on the right side, there are 2 groups of the issues. The first group we call zero tolerance group. There are 6 of them: smoking, alcohol consumption, drug use, gambling, violence, and road safety violations. And for number B, we call health promotion areas. Mean we want to see more and more in university. There are 7 items: healthy university, health literacy, mental health, social interaction, physical activity, healthy diets, safer sex behavior, and work-life balance. And these 22 areas are being advocated by the AUN HPN, trying to promote this implementation throughout not only 30 universities not only among the members, but also all other universities within and outside the ASEAN region. And then in order to measure the progress of AUN health promotion activities, those 22 areas, the president of Maidon University, Professor Ban Chong, who is with us now, also have one idea. He has one idea to develop a system for ranking of, not ranking, but rating or assessing the progress of those 22 areas. We call this HERS, or Healthy University Rating System. And this system is now being operated among the 30 members of the AUN system. And there are, as you know, there are 22 areas. But in this conference, we are talking about tobacco control. So this is the AUN HPN HERS, or Healthy University Rating System, which is developed based on these 22 areas that I already presented. And we are requesting all member universities at this moment to develop or to try to consider engage in self-rating at this moment, and in the future maybe cross-rating and scaling up to other universities in the near future. And look at the tobacco sections. There are, as you know, this is the first item of zero tolerance group, and we are looking at a policy of banning. We are looking at the prevalence of smoking among student personnel, and this will be after thinking of whatever these 4 or 5 different level of achievement, then it will lead to some score. If or university, any university with highest success, then they will get this 60 points added to all other 21 areas to come up with the total score against the overall score of 1,000, and then there be criteria for ranking of 1-star to 5-star achievement. And I would like to end by saying that right now all the universities, 30 members are beginning to pay more attention on those 22 areas and engage in the rating of their achievements. And we will see from our 4 speakers in this session on what achievement they have done right now, and maybe in the near future of what are new initiatives to promote a healthy university to become university without smoking. Thank you very much. I would like to end my presentation. Professor Witt, back to you.
Thank you very much, Ajahn Vibat. So the second presenter is Professor Yayi Suro Prabandari. He is the head of health promotion section of University of Gadjah Mada, Indonesia. Please, Professor Yayi.
Yeah, thank you, Dr. Fitz. Could you hear my voice?
Yes, very clear.
Yeah, and then I will share my, hang on, this is why this one. Hang on, yeah. Could you see the slide?
Yes.
Yeah, okay. So good morning, the audience, ladies and gentlemen. Thank you for inviting me to present the tobacco control in Indonesia and in Universitas Gadjah Mada. Universitas Gadjah Mada is the biggest and the oldest university in Indonesia. My name is Yayi Surya Prabandari. I'm at the Department of Health, Behavior, Environment, and Social Medicine in the Faculty of Medicine, Public Health, and Nursing, Universitas Gadjah Mada. And at the moment, I'm the chair of Health Promoting Campus at Gadjah Mada University. So I start with the tobacco control in Indonesia. Actually, the history of tobacco is very long, so that's why we have a lot of issues and problem how to control the tobacco industry in Indonesia. It started when the Dutch coming to Indonesia 100 years ago, and then they brought a pipe, and then they started to plant the tobacco in our country. So in 1820, there was already a tobacco industry in Central Java, then goes to in East Java, and then goes to Sumatra. So Thailand is somewhere here. Yeah, so somewhere above Indonesia. And in 2010, sorry. So there are 10 big tobacco industry, and then more than 1,000 tobacco industry, a small one, yeah. So home industry, and this one is the tobacco product that we can find in Indonesia. Yeah, cigarette, and then cloth cigarette, cigar, a pipe, and then rolling now is a little bit coming up with the young people, because they said that cheaper than they buy the cigarette. So they buy the tobacco and then they roll by themselves. And then shisha is a few years ago is a little bit common, but now the young generation is trying to use the e-cigarette or vape, yeah, beside of rolling. So because of that one, so we have 66 or 67% of male smoker, and then female is a little bit low, yeah, but this is up and down. This is the Indonesia pattern. But even though we are not yet ratified the Framework Convention on Tobacco Control, we already have some regulation. The price and tax measure, even though not the optimal things, we already issued that one. And then tobacco content in the past, we had the policy, but the government withdrew, and then labeling of tobacco product. This one we already have pictorial health warning, even though it's still 40%, and this year I think it's increased to 50%. And then we still have advertisement, but there is a policy for broadcasting the advertisement only between 9:30 p.m. to 5:30 in the morning. Yeah, so we have some regulation, and then the smoke-free area we already implemented, and the region we have more than 400 districts, and then 35 municipality, and more than half is already have the local regulation on smoke-free area. And yeah, actually, we still can find children selling or buy cigarette, even though there is a policy for buying the cigarette. And these are our pictorial health warning. Two, I think, coming from Thailand. We adopted the picture from Thailand, but at the moment, when the Ministry of Health trying to modify the picture, so we will not have the picture of this man. So all the picture will be the effect of the cigarette through the body. Yeah. So this is the road of the policy in Indonesia. It started, it's not coming from the Ministry of Health, but from the Ministry of Education in 1997, that the policy is stated that school, it should be smoke-free area. And then the regulation from the national on smoke-free area, this is issued in 2009. And then in 2012, the president also issued the substance and then how to sell and the advertisement. Yeah, so some of the regulation that we adopt from the FCTC, even though it's not complete of the FCTC. Yeah, and then but looking at the very slow policy, so some of the region and then district and also municipality trying to have what they call smoke-free house kampung or villages initiative, including Yogyakarta. Yeah, this is current policy in Indonesia that I got from the WHO. Yeah, so the smoke-free area is in healthcare facilities, yeah, all. Education, university mostly, and then government facility actually in some of the district and municipality that they already have local regulation. There's already smoke-free area actually, the indoor offices or restaurant or yeah, we don't have many pubs and bar, yeah, and then indoor place. And the benchmark that I already mentioned, that actually minimum is 70% for the tax, yeah, but we only got almost 50%, but it's, yeah, it's better than not. And then the education for the children, for the people, they already implemented, even though for the advertisement, we need still strong advocation, because advocacy already done, I think since more than 10 years ago, yeah, but we always fail. It is very difficult to delete all the advertisement in television, on radio, yeah. So what they already is the sales restriction, and also the free distribution of the cigarette, yeah. In the past, they distribute free cigarette for the music performance, but now it's already banned. And yeah, this is smoking cessation service in Indonesia in brief, but at the moment we already have quit line, started in 2017. Yeah, and that started in 2008 in the one hospital in Jakarta, but we are in Yogyakarta also started in around 2012. Yeah, we are using the primary healthcare or puskesmas. And the Ministry of Health finally in 2016 also gave training to all the providers, health providers in all provinces that they have to serve a smoking cessation service in the level of primary healthcare. Primary healthcare is in the sub-district. Yeah, so I would like to go to UGM that we already implemented and declared as a health promoting university in 2019 and started with the Faculty of Medicine. At that time, we also invited Dr. Wiwat. We also invited, Dr. Wiwat is coming to Yogyakarta, and also Dr. Fitz at that time is online. Yeah, so we already declare, and then we adopted from the framework that a lot of things, but we adopted 7. 7 is about physical activity, and then eat properly, so the nutrition, and then mental health, and also health literacy. And then we also adopt the zero tolerance of tobacco, alcohol, and drug, as well as zero tolerance of bullying, violence, and harassment. And we also adopt the healthy and green environment and friendly for disabled. We actually also have integrated the principle of 5 key action areas in health promotion. And for the zero tolerance on tobacco, alcohol, and drug, actually, Faculty of Medicine is already smoke-free campus started in 2005. Then we trying to encourage the university. So the university already become smoke-free campus in 2008. And then university actually already have a policy for banning sponsorship from the tobacco industry for any activities for the student. In our Faculty of Medicine, we also start to stop scholarship that coming from the tobacco industry in 2006. And then this one is renewed with the decree of rector, so 2019. So all the activities, including staff and students, should not have collaboration with the tobacco industry. We also have smoke cessation clinic in Gajah Mada Medical Center in 2012, and then the Student Senat and Organization for Tobacco Control and Anti-Drug. So recently, during the pandemic, we also train smoking cessation training for the health cadres. We already have what we call health integrated posts that we already trained them as a health cadre to measure the blood pressure, to measure the weight. Yeah, but we stopped in the pandemic, but we replace this training with the smoking cessation training. So when we are not in pandemic era, we can implement it. And the tobacco control in UGM actually started with the project with Tobacco Indonesia that we collaborated with University of Arizona, Kansas, Missouri, Minnesota, and Kerala Medical College in India. And we have 3 things: developing tobacco-related modules for medical students. And in that part, we also collaborated with the 2 private university in Yogyakarta and 2 in Sulawesi. And we also developing smoking cessation clinic. This is the activities 2. The second activity in Lung Clinic, District Hospital, and Primary Healthcare and Gajah Mada Medical Center in Yogyakarta. This we collaborated with the Provincial and District Health Office. And we also trying to develop smoke-free home initiative in Yogyakarta cities, started with 4 villages. Then when we ended is about more than 40, and then the Provincial Health Office continue, and now more than 200 villages already declared as smoking cessation, smoke-free home village. This is another activities that we use campaign in the World Tobacco No Tobacco Day, and this is one of the community declaration for their village to be a smoke-free village. And then this is campaign with together with Healthy Yogyakarta Without Tobacco. This is a network, and then this is 2 picture when we have a training for the health professional for establishing the smoking cessation clinic. I think that's it. This is also we have a lot of sticker poster that we already produce for all activities. And this one we expand to not only Jogja, but we went to Nusa Tenggara Barat, West Nusa Tenggara Barat, and then we try to develop also the smoke-free home village. I think that's it. I return back to Dr. Fitz. Thank you very much. Good morning.
Thank you very much, Dr. Professor Yayi. Oh, thank you for the very informative presentation about the policy at the from national level and from historical viewpoint from Indonesia to the movement in your university at the oldest university in Indonesia. Okay.
Yeah.
Thank
yeah.
you very much. Thank you very much. So we will move along the coast, the line coast, the Pacific Rim, I think, from Indonesia to Malaysia, to Singapore and to Malaysia and come to Thailand. So we will move to National University of Singapore. I would like to give this presentation to Professor Tia Yik Ying. He is the Dean of Saw Srey Kok School of Public Health, National University of Singapore. Please, Dr. Professor YY.
Thank you very much, Dr. Vic, and thank you very much for the invitation to share a little bit about what we are doing in Singapore and the universities in Singapore. For us, the universities actually have to follow national laws. They can put in place additional policies, but otherwise the bare minimum is actually the national laws. So I thought I would start off with actually highlighting some of the activities around tobacco control that we have in Singapore. And I think when we touch on tobacco control, there is a lot of guidance that is available out there, whether it is the SCTC or the best buys from WHO in terms of tackling the NCDs. And I thought I would just highlight some of the best buys. And we could very quickly see that the best buys that I've highlighted here around taxation, packaging, advertising bans, smoke-free places, and education were exactly the kind of activities that Dr. Wiwat and Professor Yayi actually shared happening in ASEAN and in Indonesia. And along the lines of the kind of activities that we want the world actually to follow, including looking at the impact of using excise taxes to not just encourage cessation, but also to discourage people from initiating, particularly young children. And later on, I would actually highlight what the policies that we have in Singapore are that is very much aligned to some of the guidance that we have on the best buys. So I thought it's useful to look at who are the key actors in driving this space in tobacco control. Firstly, tobacco control laws are established under the jurisdiction of the Ministry of Health. But if we now start to see which agencies implement some of these rules, this is exactly where education, the Ministry of Education, comes in to be a key partner in driving the implementation, including the Environment Agency, the Ministry of Finance that looks after the taxation policies, and definitely organizations that look after use, because we know that the initiation of smoking happens most commonly amongst young people below the age of 25. So if we look at the chart on the right, Singapore, we have been very fortunate to see that our tobacco control policies actually have helped to drive the prevalence of smoking down from in early days around 20%. Right now in 2020, we see that the smoking prevalence is around 11%. Now, 11% is of course the overall prevalence, with males more likely to smoke than females as well. But I think we can continue to drive this down even further. And this is where the policies that we have in place in Singapore becomes important. And if we look at what are the policies, and I suspect this is going to be the main slide that will highlight a lot of the activities around tobacco control laws in Singapore. We have very clear rules around when people can start smoking. And in fact, some of the recent changes actually, it's on the minimum legal age that we have in Singapore, which currently is 21 years old in Singapore, which is amongst the highest in the world. And actually at the School of Public Health in NUS, together with the Health Promotion Board, which is very much like the Thai Health Promotion Foundation in Thailand, the Singapore Health Promotion Board and the School of Public Health, we have been partnering to drive this minimum legal age to increase even beyond 21, to keep increasing year by year until 2025. And this is a work in progress that we hope that the government of Singapore will actually take up our recommendations. But beyond that, beyond when people can start to smoke, we actually have very specific rules that have been introduced in recent years. And I think it's useful to show some of this. For example, we now have a plain packaging policy in Singapore for tobacco products, that there will no longer be any branding, that we allow the tobacco companies to do so. They have to stick to the plain packaging, which is a very dull brown packaging that people put on, including, of course, the deterrent visual pictures to try and get people not to initiate. But I think we know that some of these efforts, it's really to try and denormalize this perception of smoking, because we don't want people to feel that it is normal to smoke, to the point that right now, the point of sale display ban. So if you go to any convenience store in Singapore, any supermarket chain to buy cigarettes right now, you will not be able to see packets of cigarettes being advertised. They all have to be behind a cabinet, such that this is what we call the point of sale display ban. We no longer allow the sellers to actually display tobacco products. It has to be behind a cabinet. Singapore, like Thailand and some of our other neighbors in Southeast Asia, there is a no vaping policy in the country. So we do not permit the use of e-cigarettes. But unfortunately, with internet sales being very common these days, people are buying e-cigarettes online and getting them shipped into Singapore. And it is very difficult to stop all shipment of e-cigarette products into Singapore. I believe this is the same as what some of our countries in ASEAN have also found. But there is a very clear and message that there is no sales that is allowed, and the penalty for being caught for e-cigarette sales is actually very high. So in Singapore, the country is very small. So trying to enforce certain rules around some of these tobacco control laws becomes a lot easier. And it's really through some of all these efforts that we are able to drive down smoking prevalence. One key change that has happened in Singapore, it's the gradual move to look at designating all public spaces as non-smoking zones. Right now, we have a pilot that is happening in Orchard Road, which is the main shopping district, including where a lot of tourists actually stay in hotels along Orchard Road. This entire road now is actually designated a non-smoking zone. So you can't actually smoke while walking along this road. And I think this is something that we would like to roll out to all other parts of Singapore as well. And what that means is that if we are successful in doing this, the public spaces, not just indoor space, all indoor spaces now, including pubs, discos, where people get their drinks, all of those are designated non-smoking area already. Clubs and pubs, including clubs and pubs, are all designated non-smoking indoor areas. What we want to do now is actually to roll this out to include outdoor spaces, outdoor public spaces. And therefore, anyone who wants to smoke in public have to go to one of these yellow boxes, and you have to stand inside the yellow box to smoke. And it is, again, another effort to really denormalize this image of smoking. So those are some of the recent developments that we have in Singapore around tobacco control. But I think moving ahead, we continue to look at what additional laws and policies can we put in place. And this is really where when we start to look at some of the FCTC or WHO best buys recommendation, we ask the question, what are the measures that we should adopt that will be useful? But actually from academia's perspective, we always turn the question around. It's not just which measure should you adopt, but rather which measure is likely to have the biggest impact in your specific country. Because every time we put in place a measure, a policy, we always want it to have a certain outcome. And this is the impact, the outcome that we need to look at. And the university has a very important role to actually help the government evaluate what is the impact, whether it is to continue increase the minimum legal age, making it harder for people to start smoking. Is it about increasing taxation, allowing certain laws on e-cigarettes? So trying to look at all of these different policies that you want to introduce further, there is the role that academics can play in looking at how it will shift tobacco prevalence in future. So this is actually something that we have been working closely with the government on. And I always like to highlight that a lot of the health policies, not just in tobacco control, including nutrition, physical activity, actually depend on the local context, and we need to always understand what is the likely impact. So very quickly, I will now come to what are the policies that we have in universities, other than to say that the universities have to follow national laws, but the universities actually included an additional series of policies, such as early as 2017, we designate all outdoor spaces in the university to be smoke-free. So NUS, the Nanyang Technological University, the Singapore Management University, the universities that we have in Singapore have always been designated as non-smoking campus. But because the roads are considered not the property of the university, so actually you can actually smoke if you're walking along the roads. But right now, the entire university compound is considered a non-smoking area. And if you want to smoke, there is a law that says it has to be 5 meters away from the boundary of the university. And actually, this has created some conflict between the university and some of the neighboring residential estates, because a lot of our overseas students, when they come to Singapore for short courses, they actually want to smoke, and they will move to that 5 meters zone to start smoking. And that 5 meter actually is where people's houses starts. So that's where some of these conflicts actually do happen because of the smoking ban that we have in the university. But in addition to that, we focus a lot on cessation programs in the university because we want to promote this concept that we help you stop smoking when you are in the university. And we have seen actually the uptake of this to be quite high. So I actually went in to check again for the smoking cessation program that we have coming up in September and October is completely signed up. And we run these programs every month, and about every 3 to 4 times every month, and it's completely signed up. So we can see that the uptake is actually quite high. So in summary, Singapore continues to be committed to reduce the prevalence. We want to drive this down below 10% if possible. We need multiple layers. It is never just taxation alone. It is never just advertising ban. On the bit about advertising ban, I would just like to highlight that Singapore does not allow any form of advertising at all if it's related to tobacco product. And universities, like what we heard from Professor Yayi in Gajah Mada, we do not permit the university to take up funding support from any tobacco company. And in fact, even if I have to take on board membership, we actually do a background check to see whether the company that we have that has offered us board membership or director membership have any board members that sit on tobacco company. So this second layer and third layer checks are a clear signal to everyone in the university that we stay away from any activities that is funded by the university. Finally, I mentioned we align with the national stance to implement a smoke-free campus policy. And with that, I end my presentation, and thank you once again, and I pass it back to Dr. Vid. Thank you.
Thank you very much, Dr. Professor Teo. This is a very impressive presentation. That congratulations to Singapore that your prevalence is very low, 11%. Oh, very impressive. And you emphasis on using law and also regulation. This is a Singapore style, not Singapore style. It is a style of managing high risk tobacco or anything like that. I think it is evidence around the world that using policy is very crucial to control risk factor. Tobacco is the example, the main example of using policy. So you show that we need to advocate more, even pushing for the plain packaging, right? This is foreign like Australia. And also you pushing for outdoor space, no smoking. Very impressive. Thank you very much for the very impressive presentation. So we will move to Malaysia. So we have a presenter from University of Malaya, Professor Fariza Mod Hari. Please
Yes.
share with us your tobacco control in your university and your country. Thank you. Please.
Thank you very much, Dr. Vich. I'll be sharing with you the work that we have done in University of Malaya. Let me try to share the screen. Oh, start video.
We make you host already.
All right. Is this? Can you all see this?
Yes, yes, clear, very clear.
Okay. Thank you. Thank you very much for giving me the opportunity to present our journey in University of Malaya in terms of the tobacco control work that we have all done in the university. Like what we have heard from Indonesia and Singapore, they have done a lot of work in their areas. And I'm also very impressed to see that Singapore's smoking prevalence is only 11%, and we have a long way to go to reach that level. So to move on, most of the things that we do in the university is hand in hand with what the policy is in our own country. So to move on, we have our national strategic plan for Malaysia in terms of tobacco control, which was formulated in 2015 up to 2020, and a continuation from 2020, now 2021 to 2030. So we have our second national strategic plan for the control of tobacco and smoking products. So we added on the smoking products as well, because as we know now, there are more new electronic devices and also heat not burn and all these new devices in terms of encouraging people to smoke rather than helping them to quit smoking. So in that particular national strategic plan, what we aim for is towards the end game for tobacco of the prevalence of smokers less than 5% by 2040. So we hope by 2040 we are able to achieve our end game target. So the current situation in Malaysia is that we have 4.7 million smokers, and we know that around the world the death is a lot. More than 8 million people die because of smoking and smoking related diseases. And in our country itself, about 20,000 people die due to smoking every year. And the cost of treatment for smoking, as well as smoking being the risk factors of all these major diseases, is also very, very high. And this is the prevalence of our smokers in the country, those aged 15 years and above. So this is based on our National Health and Morbidity Survey, which is conducted very frequently. So the last one was in 2019. So among the smokers, Overall, our smoking prevalence is hovers around 21.3%, but for the smokers, majority are men. So more than 40.5% among the men, and women smokers are slightly 1% or less, slightly less. So what is NARCC? So what I'm going to share with you is actually our research group in the University of Malaya, which is called the Nicotine Addiction Research Collaboration Group, or in short NARCC, which was initiated in 2009 by a multidisciplinary group of academics who are interested in conducting research and providing services in nicotine addiction. Also in terms of providing activities and in line with the tobacco control policy in the country. So in 2015, our research group managed to get a research grant, quite a bit of a research grant, for us to be able to conduct multiple activities. And in 2018, we collaborated with the ITC group with the University of Waterloo in Canada, and we continued the ITC Malaysia for 2020. Initially, the ITC project for Malaysia was hosted by University Science Malaysia in Penang, the previous waves. So this current new wave in 2020, which we conducted, is now being coordinated by our university, University of Malaya. So we did the wave 1 of the new cohort in 2020, and we also conducted several e-cigarette projects and also the e-value projects in 2021. So the main research grant which we obtained to assist us in conducting tobacco control activities includes the training component, the treatment component, the innovation, and also the advocacy component. So for the training component, we developed our own module, smoking cessation module, which we call SCOOP. And with that, we are able to train more than 5,000 people who are interested in helping others to quit smoking. So we collaborated with Ministry of Health, and our SCOPE training program is also recognized as one of the training program which is also used by Ministry of Health. And for the treatment component, we had done several studies. One of them is a study where we provide box of choices for the smokers to help them to choose which treatment modalities is their preferred choice. So we want to understand the smokers and what is it the nicotine treatment which is available that they would like to have, giving them options. And we also have we also developed a Malaysian group-based smoking cessation program, which it is adapted from the New Zealand group-based smoking cessation program. And then for this particular projects, we also have other innovation projects that we do. We use the current technology, digitalization, where we develop a quit smoking app, which we call GEMPA. It is actually an acronym of getting every smoker to participate and quit smoking. So this currently, this particular app is being tested. And we also have a validation of mobile phone-based ICO smokerizer, comparing to the Pico smokerizer. And in the advocacy arm, we encourage our university students and help them do a lot of advocacy work. And we also form a no nicotine club, which is stop smoking club among the university students. And at the same time, we also because around the university we have several schools which we actually adopted, and we also go out to the schools to do our advocacy work, and we develop a book, a storybook for the younger children, so that they can understand what smoking does, the harm that smoking does to others. So as what I've already mentioned just now, the two most important things that our research group is actually doing, we are focusing on the smoking cessation component and also the prevention component. So for the smoking cessation services, we work together hand in hand with Ministry of Health, and Ministry of Health has developed an MQuit services, which previously was not enhanced, because most of the time in the previous works that what our country have done, we focuses on the prevention component. We had a lot of promotion, prevention in terms of telling people the harmfulness of smoking and the side effect of smoking. But now we would also want to enhance and improve the quit smoking services. So we work hand in hand with Ministry of Health, Ministry of Higher Education, and also the private sector. And we know that those who are given advice to quit, they will actually tend to quit smoking. So, and in terms of treatment, the smoking cessation treatments, we found that to have a combination of pharmacotherapy as well as the behavioral therapy is the best. It is more effective as compared to just having your medications to treat smokers and help them to quit smoking. So we are also involved in CPG, in the clinical practice guidelines, in helping the practitioners in helping smokers to stop smoking. And we also help in the training in the tobacco control, which includes the smoking cessation, so that we did a few studies, and we found that those who are able, those who understand, and those who are more confident in actually giving out this smoking cessation program, they are able to execute our quit smoking clinics better. And we have our quit line as well, and we know that quit line is an effective measure in terms of helping the smokers to quit smoking. So this is one of the activities that we do. We have our smoking cessation training program, which we call SCOPE. In short, we started it in 2009 from a small grant, and then it develops as time goes on. And in 2015, which I mentioned just now, where we got another bigger grant where we collaborate with Ministry of Health at the same time. So in 2015, we developed, we improved our smoking cessation training, and at this during this time, we also incorporated the MQuit program within our projects. So the MQuit has already been launched in 2016 by the Ministry of Health, together with several universities and also the private sector. And now we are in the phase 3 of the MQuit program. It has already been updated and also improved. So the phase 3 MQuit program was actually signed in December 2020. So it was launched in the early phase of 2021. And for our SCOPE smoking cessation training program, we have developed several handbooks. We have developed a handbook for the trainers themselves, and also a handbook for the advocacy. So this is what we did for the projects among the university students. So in the initial stage where we developed our smoking cessation training program, we gathered all the different universities, members from several universities, as well as from the Ministry of Health, from our own university itself. and there are many different specialists involved. So it's not just for myself, I'm a public health medicine specialist. We have a psychiatrist, Prof. Ame, who is the head and the lead for this particular project. And we also have behavioral scientists, we have physicians, and primary care physicians. We have several other different background, and it's a collaborative effort in terms of developing the modules as well as providing the training. So these are some of the pictures just to share with you. When the MQuIT project was being launched by Ministry of Health, initially the Memorandum of Understanding was signed in 2015, and then the launch of it was in 2016, and then subsequently phase 2 2017, and now phase 3 in 2021. And here are some of the examples and some of the photographs of our scope training, which we actually did this training throughout the whole country. So it's not just in Kuala Lumpur. We were doing this since 2015. So all these photographs were taken before the pandemic happens. So, and now once pandemic came in, we managed to digitalize our scope training. So it is now conducted online via digital. And this is some of the advocacy work with our University Malaya students. We formed the Nokotin Society, where we want to encourage advocacy among the students, and this is in line with the Tobacco-Free Campus initiative. So another project that we are actually embarking on is these apps, where we develop Gempak to get every smoker to participate and quit smoking. So this app, oh, sorry. Okay. All right. Thank you very much for that. So this app is to help all the smokers to stop smoking. And this is just some other photographs showing all the other activities that we are involved with, especially during the World No Tobacco Day and the launching of the club, and advocacy work, the conferences. So basically, in conclusion, this Grand Challenge initiative has actually assisted us in improving tobacco control initiatives in the university itself, as well as in Malaysia, because we work hand in hand with Ministry of Health. And we know that monitoring and evaluation of the program is very, very crucial and very important for us to move forward and to strengthen the program. With that, I thank you. So we also have a short video, which I'm not sure whether it can be shown now or it's
we will
later.
We will put it on our room. Okay. We will pass to another presenter.
Okay. Thank you very much.
Thank you very much. Thank you very much. Okay. Thank you, Dr. Fariza. You also portray the work of University of Malaya in terms of like tobacco cessation movement. You start in your university and you extend it throughout your country in Malaysia. It's very impressive. Thank you very much. Thank you very much. So the last presenter is Professor Banchong Mahai Sarariya. He is the president of Mahidol University, and also a chair of AUN HPN Advisory Committee, International Advisory Committee. Please, Dr. Banchong, please. Professor Banchong.
Thank you, Dr. Wich. Dr. Viwat, Dr. Yayi, Dr. Theos, and also Dr. Ailik, and participants. First of all, I would like to thank the organizers for the invitation. What I would present is something that happened in Mahidol University. And Can you see my slide? It's okay. Yeah. Okay.
Yes.
So I would talk about the backward in 30 years ago that many of our former teachers had taken lead in tobacco control. Mahidol has been the leader in such kind of events, start from 30 years ago. And the staff from Mahidol University try to advocate the government about the control of tobacco in Thailand. And the former deans of the faculty of medicine, Lamatipdi, Professor Prakit Wati Satokit, he's a chest medicine advocates the policy, the government policy to raising the tobacco tax and using 2% of tobacco and alcohol tax to establish Thai Health Promotion Foundation and introduce Thai Health using this innovative financing to tobacco tax has strengthened other health promoting movement in Thailand. And I would acknowledge two of our senior leaders in the former time in 1986. Left-hand side is Professor Atasit Vechachiwa, former deans of the Faculty of Medicine, Lamatipdi Hospital, and the right-hand side, Professor Pravet Vasi, also chairman, vice chairman of the Mahidol University Council. They established the Thai anti-smoking campaign project, which have been expanded all over our countries. And this is the activity that happened in 1986, anti-smoking program launched at the Faculty of Medicine, Lamatipdi Hospital. And if you take a look, this is Professor Atasit, and this is Professor Sen Ping Phuong Keo, who is a very famous one and former Minister of Public Health. And these are big names. And this is the Prime Minister Chuan, former Prime Minister Chuan. So anti-smoking program has been established first in Mahidol University and expand all over our countries. And press conference in 1988 by Professor Prakit Wati Satokit and try to encourage and promote the tobacco control in our country by raising the tobacco tax, banning tobacco advertising, and prohibit smoking in public areas. And Professor Prakit, former dean of the Faculty of Medicine, Lamatipdi, has testified on USCR public hearing after the first APACT meeting in 1989. At Mahidol University, we have regulation all over every campus of Mahidol University. Start from 12 years ago from former President Piyasakon, and later on by Professor Rachata Nawin. And all the campus in Mahidol University, including Saraya, which is our main campus, we all advertise and showing the prohibitions of smoking all over the campus, either by posting in the bicycle and also the electric bus. Every campus we have a sign show about prohibit of smoking in our campus. This is the prohibition of smoking in other campus. We have outside Bangkok, like let's say in Nakhon Pathom province, Nakhon Sawan province, and also Amnacharan province. They all comply with our regulation and try to encourage the prohibitions of the smoking in the campus. And we also have many campaigns and events to stop smoking among our staff and students. Create several programs of anti-smoking movement, such as the Heroes No Smoking, to find role models of smoking cessation among university personnel. Smoking cessation clinic for university personnel. Campaign for anti-smoking in all university events, and integrate anti-smoking issue into the curriculum. And this year, in March 18th, I declare and announce to stop receiving funds from tobacco industry and stop receiving funds from tobacco industry in order to ensure academic freedom of our academic staff. Mahidol University announced our intention to stop receiving funds from tobacco industry. And as a chairman of the International Advisory Committee of ASEAN University Network, Health Promotion Network, we propose to all members university to announce their intention to stop receiving funds from tobacco industry as well as in the 6th IAC meeting on November 5th, 2020. And Mahidol University held a press conference on March 18, 2021 this year to disseminate our intention to all of our staff and Thai general public. And this is a press conference, stop receiving funds from tobacco industry on March 18 this year. And this is Professor Viwat, and right hand side is my Vice President, Noprenu, Professor Noprenu. And this is a panel discussion on stop receiving funds from tobacco company and their alliance this year. And this is Professor Prakit Watisa Tokit as a panelist. Tobacco Control Research and Knowledge Management Centers, the TRC, has been established since 2005 with funding from Thai Health Promotion Foundations. TRC intends to produce cutting-edge knowledge to support tobacco control movement both in Thailand and other countries. TRC supports both new coming and long-standing researchers on tobacco control, and also plan to translate research findings for policy advocacy. And Mahidol University intends to share our experience on supporting research and knowledge management of tobacco controls to other fellow universities in ASEAN, Asia Pacific, and other regions. And this is our activities and brochure that announced by our Ministry of Public Health. And TRC also have many infographics for promotions, mostly in Thai. And this one also from Ramathipati, posting in the hospital, and also encourage most of the people who admit or who go to the hospital to receive the information about the COVID. The patient with a smoker will have high mortality, about 14 times compared to non-smoking people. And we would like to propose a clear vision of the world without tobacco. Tobacco is not a normal commodity, as it is a main risk factor killing millions of people each year. Moreover, tobacco industry keep producing a new form of products, such as an e-cigarette, that also cause serious health problems. Mahidol University would like to propose an ambitious goal for our fellow university, both in ASEAN University Network and other regions of the world, that we will provide the best of our effort to support movement for the end game of tobacco use and to set for a very clear vision of the world without tobacco. And I would encourage partner of the AUN HPN try to promote the smoking cessation in all of our members. So this is our activity that Mahidol try to advocate to people in our nation. So thank you so much for listening. Back to Dr. Witt. Thank you.
Thank you very much, Mr. President. Professor Banjong Mahai-Savariya. So it is a very clear vision that today we come together and we try to disseminate our intention as a network of Asian University Network, Health Promotion Network, that we will try our best to end game of the tobacco use. and we will set our vision high, very clear that we will do best of our effort to end and will produce the world without tobacco. Thank you for this very clear vision for both ASEAN University Network, Health Promotion Network, and other universities around the world. Thank you, Mr. President. Thank you. Thank you very much. So I have been informed that we have to finish our session by noon, but we are in time. We would like to thank as AUN HPN. I would like to give the last words to our former executive director of AUN HPN, Professor Dr. Vivat Rojanapitiyakon, to have the last words for this meeting and for our fellow university. Thank you. Please.
Okay, thank you very much, Professor Witt. I would like, on behalf of AUN HPN, I would like to thank all four speakers, President of Maidan University and representative from 3 universities in our AUN network. I hope that we work together because we are talking about the world without tobacco, and universities are leaders in the societies that can advocate, make people, convince people to fight together all the tobacco products. And now we are facing very difficult problems of the promotion of e-cigarettes and other heat tobacco products. So it's very difficult to fight unless we join hands together. And what we are talking today is not just to collect all the the work that we have done and to present the work we have done in only a few universities, but this is just example, and I hope that we have a chance to share more on how to build capacity of university in on the work to promote tobacco-free setting of tobacco-free society and tobacco-free country. And AUN HPN is planning to have some sort of capacity building workshop among AUN members and associate members in the area of the capacity building in the area of tobacco control for each university participating in this workshop. They are all AUN member and associate members, and we hope that in the far future we can also promote this type of capacity building in other universities in the region and also outside the region, together with the World Health Organization and other organizations. So again, thank you very much for your attention, and again, thank all the 4 speakers that help us have a clear vision on how university setting can deal with the problem of tobacco control in the region. Thank you very much. Thank you.
Thank you very much.
Thank you so much. Bye-bye.
Thank you.
Bye-bye. Bye-bye. Thank you.
Thank you.
Thank you.
Stay healthy.
Okay, thank you very much, Dr. Vivat, Professor Witt, and Dr. Professor Manchong, and all the speakers on the Asian University Health Promotion. I would like to say that your session has been very interesting, with more than 150 participants attending the session. Congratulations. Okay.
I hope that the organizer can put this record to deliver this message to the wider society in the at the end of the conference. Thank you very much.
Yes, on this additional session, I would like to present you some wrap-up in brief of the APACT 2021, which has been launched since the 2nd of September, including the young training program on the 2nd, and the actual APACT 2021 has been organized and continued from yesterday, the September the 3rd. This is a collaboration activity, the APACT 2021 in Thailand, of the 16 organizations, including the Ministry of Public Health, the Health Promotion Bureau, the Thai Health Professional Alliance Against Tobacco, the National Alliance Tobacco Free Thailand, the TRC, the Thailand Tobacco Research Center, SIETCA, the Southeast Asia Tobacco Control Agency, the John Tung Foundation, the Medical Association of Thailand, Bangkok Metropolitan Administration, the Medical Council, universities, various universities, the Global Center for Good Governance in Tobacco Control, or GGTC, the Center Group, and the Thailand Convention and Exhibition Bureau. The convention is divided into 3 combination occasions. They are the centennial celebration of the Medical Association of Thailand, the APACT 2021, the 13th APACT 2021, and the International Conference of the Thailand Research Center. On the 2nd September, youth program was carried out successfully with 70 youth from 10 countries attended, targeted at delivery of their ability to expand the anti-tobacco activities and creating new innovations in fighting with the tobacco marketing. They also success in creating the resolution at the end. Continue on the 3rd September, the APACT 2021 program was started at 9 o'clock in Thailand, with registration from participants more than 4,000. Actually, it's more than 4,300. There were 17 sessions of the interesting subjects, started from introduction of the past, present, and the future of tobacco control in Thailand and beyond, by Professor Ronachai Khongsakon, the chair of the APACT 2021. The session was followed by the plenary lecture on David Yen Memorial given by Dr. Simon Chapman in the topic of Myth-busting e-cigarette, what vaping advocates would you larger did not know. Then the conference divided into 6 rooms. The program were interesting and fruitful discussion. The opening ceremony was taken place in the evening with several messages from leaders of the organization and the countries, including World Health Organization, FCTC, CMAO, or Confederation of the Medical Association in Asia Oceania, ASEAN, or Medical Association in ASEAN country, and national medical associations. On the 4th of September, today, the program started at 9 o'clock in the morning in Thailand, with 13 sessions in 7 conference rooms. The environment of the conference is shown on the recording video. Please enjoy. Yes, that's a brief recorded video for what going on behind the scene. Yeah. Moreover than the conference room, we also the APACT 2021 also offer the 7 more sessions, seven more rooms you can visit to get more idea of the events, such as the exhibition, the free paper presentations, the media package, ASEAN Network, Thailand key operation leaders, and life support. I have at the moment Dr. Nath Fongsamut with me. She is a medical doctor from the the Faculty of Medicine, Chulalongkorn University. She graduate School of Management of Boston University, and she specialized in the field of specialization in senior care and senior living. At this APEC 2021, she is the organizing committee of the exhibition and also the chairperson of the TRC International Conference. I would like to invite Dr. Nath Fongsamut, who has been responsible for the exhibition, to speak something about the interesting points and notes from the exhibition hall. Please, Dr. Nath.
Thank you, Professor Wanchat. Hello, nice to meet you. At our virtual meeting of APAC 2021, we also have our virtual exhibition part, which is very interesting and very innovative and interactive. If we enter into the exhibition room, we will find booths from various organizations in Thailand who are working on the work of the tobacco control. The first one is the booth of the Medical Association of Thailand. At this booth, we will learn from 100-year work of the Medical Association of Thailand. That is the organization to promote the activities of doctors in Thailand, and also they have a lot of public works, including tobacco control work. So if you visit this booth, you will learn a lot of activities from the Medical Association. The second one is the booth from the Ministry of Health, of Public Health in Thailand. So the Ministry of Public Health in Thailand is doing a lot of groundwork as well. They have got information on video clips and all the posters where you can learn and make use of the information of the Ministry of Public Health work. And also on the right-hand side, we have the booth of TRC, which is the Tobacco Research and Knowledge Management Center in Thailand, where you can find, lots of innovative works, such as the TRC Data Center, which is the initiative of Professor Ronachai Kongsakon of TRC to put all the information of work in the field of tobacco control available to those who work in this field to be accessed easily by a website. And also for the ease of use, we have put all the information online application as well. So if you come to this booth, please register and make use of all the information being available on the website and also online application. Also in the work of private sector in Thailand, promoting the control of tobacco in Thailand at the booth called Magic Breath. At the Magic Breath booth. It's the collaboration of the Tobacco Society, Tobacco Control Society, and the public conglomerate named Central Group. We have done these activities and groundwork for almost 3 years already together. And the work of the Magic Breath is helping the public to understand the quality of breath and the tobacco control. So it's a lot of work, and you can learn from us here how we do the public work together with private sector, which is the Central Group. They have got documents and all the video to show how we do the activities during the past 3 years. And the last one, last but not least, is the Tobacco Control Alliances, where we gather all the private and public and NGOs groups who are working in Thailand for a long period of time to promote all the tobacco control activities. And there are lessons learned from also these groups. So if you visit, you can see all the activities from these small groups. We would put all these booths available for you to study and to learn from, and also to download all the information for 3 months, such as the history of the tobacco control in Thailand, which is very well done in English. So it would be available for 3 months for you to get access to. Thank you very much. Back to Dr. Wanchat, please.
Apart from the education, discussion, experience exchanging, we also would like you to see what has been doing in the past, and especially in Thailand, including many organizations that had been collaboration with the Thai Health Professional Alliance and the Medical Association and National Alliance for Tobacco-Free Thailand, and join our activity together. And I think that with this kind of collaboration, and also we need the international collaboration, if we can go together and make it stronger, and continuous activity should be done, I think that the anti-smoking campaign or our activity in helping our younger generation to preserve their health will be successful, especially at the present, the tobacco marketing has been very, very strong with the power of the money from the tobacco manufacturers or tobacco companies. Especially they are changing from conventional cigarette or smoke cigarette into a new device, because they are trying to escape from our fighting with the educational and research work that in the conventional cigarette they have a lot of toxic material, toxic component, from noxious gas to heavy metal, which can cause a lot of diseases in the body, not just the lung, but to the heart, to the brain, to the kidney, and the liver, and also damage to the cardiovascular system. So in that case, they know, but pretend not to know of this dangerous effect from the tobacco leaves and tobacco product that they have been already produced to the market for 500 years, starting from the fashion until now, because we are finding a lot of research work that the product has been very dangerous to the health of the people or human health. So they are trying to move from the conventional tobacco to what they call the electronic cigarette, which is still mainly based on the nicotine, because they are extracting nicotine from tobacco leaves and leave the carbon material and try to market to the young that the electric cigarette or e-cigarette can be harmless or can be replace the conventional cigarette. But actually that's not true at all, because they only give a halfway information. Like a coin, they only have giving one side of the coin, but the other side of the coin they are not disclosing. That is the danger of the nicotine, which is a main component in the e-juice. And with this e-juice, they can put any concentration on the juice. And you well know that the nicotine is potent addictive agents. So it will be very difficult to stop smoking e-cigarette. It's something like you move from opium and tell people stop taking opium but use the heroin instead. So this is why it's a very nonsense to me to move from one crude tobacco to the more fine tobacco product like nicotine extraction. And it will be very difficult to stop smoking e-cigarette, I'm sure, because they got addicted on that nicotine already. And nicotine is not less harmful, it's even more harmful, I think. Yes. In this, I would like to ask Dr. Nath, what is the TRC data center and how is to be used? Thank you.
Thank you, Professor Vanchad. Thank you for asking about TRC data center. It came several years ago when we realized that all the information should be made accessible to those who are researchers and those who work in the field of tobacco control to get access to. So we set up all the database on cloud for the database of research papers done in Thailand, and also international papers would be available and would be accessed for all the researchers and workers in this field through online. So we spent about 2 years already to get all the information, which is mainly, the research papers are mainly in Thai, here in Thailand. We have it done and put it in English and put it available to the researchers. And also all the tobacco control materials, marketing activities from our tobacco control alliances. We gather all the information and put all the information, all the the marketing or the promotion materials available online as well. That's why TRC data center, or also called TDC, is made available. And at the exhibition at this APACT 2021, we made a launch of this application of this data center, and also the line application that goes along with the data center to make all the information needed for those who work in this field available easily to them. And we plan also in the future to link up with all the international institutions or universities who are working also in this field, and also to get access to the database internationally for to be made all the information available to the researchers in Thailand and also researchers nationwide, worldwide as well. So this is how we manage all the information digitally these days. Thank you, Professor Vanchad.
Yes, thank you very much, Dr. Nath. I take off the mask for the more clearly speaking. Okay, all the information of this event, the APACT 2021, will be recorded and presented in the website of the APACT 2021. You can enjoy later. It will be on the website for 3 months.
3 months.
For 3 months, right?
Yes.
Yes, and you can enjoy later. If you have any interesting on any subject, you can look at it and find it in the website. Yes. At 1 o'clock this afternoon, there will be a further program. The program will start at 1 o'clock with the plenary lecture on tobacco control without walls, which will be moderated by Khun Bang On Lithipakdi from the Sietka. The topic would be the tobacco control without walls, and the speaker, there will be a very well-known speaker, pronounced speaker by Senator Cayetano Suprida Udunyanon, Dudley Taplifon, T. Dorothy Sai. That will be at from 1 o'clock to 1:45, and then will be followed by the plenary session, plenary lecture. This is a very important one because working with the tobacco cessation will take a very long time. It's a lengthy process because of the addiction. So we decided to continue our work from APACT to APACT. So we will have Dr. Nurul Langkutan from Indonesia will be the speaker representing the APACT 12 in Bali. What happened and what's going on from Bali, and then will follow by what Professor Ronachai is receiving the task, the duty of the APACT to Thailand, and in the next 2 years we will have Malaysia as the host country of APACT 14, and Dr. Amor Siddiq Amar Nordin will be representing and presenting the plan for the Malaysia APACT 2023. And from that, we will have the Research Awards, the Young Investigator Awards at 2:30 to 2:45, followed by the resolution announcement of APACT 13, will take place at 2:45 to 3 o'clock. And then after that, we will have the closing ceremony of the APACT 13. The closing ceremony will be done by a speech by APACT representatives, Dr. Judith McKay, and then after and followed by the speech by Dr. Professor Ronachai Rongkong, the chairman of the 13th Asia Pacific Conference on Tobacco or Health. And then we'll have the chain and the flag handover from Thailand to Malaysia. This will be a spectacular event for the transferring the chain and also the flag, which will be the first time in APAC meeting that we creating the flag for the APAC. And then we will present the video from Malaysia to tell you something about what would happen on the 14th APAC meeting in Malaysia. This will be done by the Malaysia team, and followed by the closing remarks from Dr. Renu Madanyal Kak, the representative of the WHO to Thailand. And then the closing down after the song of the Magic Breath. So please follow our schedule. I think we still have some time left before 1 o'clock. Would there be any question or any comment on these 2 days conference and many sessions? We will try to answer that. If we cannot answer that, we will answer you by email by the speakers on each session. But if we can do it, we can do it now. In any question from these participants that we can clear your mind, if there is anything you would like to ask. Please, welcome. Okay, Dr. Nath, do you have anything to add some more on this to fill up the gap?
Thank you, Professor Vanchad. Last but not least, we are approaching the end of this, international conference, APACT 2021, which is conducted under, the circumstance of COVID-19. But when it is virtual exhibition, we find another benefits from being virtual. All the information being presented and all the exhibitions regarding all the work in Thailand, a lot of activities in Thailand would be available to you for the next 3 months. So you will have more time to gain access to this type of information, and most of the information is available for download as well. So I'm quite glad for this exhibition to show to all of you the activities of the tobacco control in Thailand, also for today and in the future as well. Thank you very much, Dr. Vanchad.
Yes, thank you. Dr. Nath, is there any question from the participants that we can help you clearing all the questions? And if you like to make any comment, it will be very most welcome. You can join us making, some notes or some notice or comment. It is a very first time that we had this kind of virtual transmission or virtual platform for this kind of big meeting. And if there is anything not quite happy for you, please, we can make it as better in the next time.